The principal area of the brain that is examined with the coordination part of the neurological examination is that of the cerebellum. The cerebellum is incredibly important for motor learning and for the timing of motor activity. The cerebellum is important as far as the timing, the sequencing of the activation of agonist and antagonist muscles across joints and through the extremities as well as the trunk, to be able to create movements that are smooth and goal-directed, to be able to get to a point in a direct, straight fashion. Symptoms or findings of cerebellar dysfunction include decomposition of movement, so the movement is broken into its parts, as well as dysmetria, which is the under and the overshooting of the act. These two elements of decomposition of movement and dysmetria are the two main elements seen in ataxia, which is the major manifestation of cerebellar dysfunction. The cerebellum has three functional subdivisions, which function as feedback and feed-forward systems. The first functional subdivision is the vestibulocerebellum. This consists of connections between the vestibular system and the flocculonodular lobe. Dysfunction of this system results in nystagmus, truncal instability, which is called titubation, and truncal ataxia. The second subdivision is the spinocerebellum. This system consists of connections between the proprioceptive information coming from the spinal cord to the vermis and paravermis regions with corrective feedback predominantly to the muscles of truncal stability and gait. Dysfunction of this system results in gait and truncal ataxia. Clinically, the ataxic syndromes caused by vestibulocerebellar and spinocerebellar disease are lumped together and are called midline or equilibratory. Equilibratory meaning gait ataxias. The hallmark of these midline ataxic syndromes are truncal instability manifested by titubation, which is a tremor of the trunk, a coarse tremor of the trunk, in an anterior-posterior plane at about 3 to 4 hertz, and gait ataxia, which is wide-based, irregular steps with lateral veering. The third subdivision of the cerebellum is the cerebrocerebellum. This system consists of connections from the cerebral cortex to the cerebellar hemispheres, then back to the cerebral cortex. This system is important in motor planning. Dysfunction of the cerebellar hemispheres results in ataxia of speech, called scanning dysarthria, and ataxia of the extremities, or appendicular ataxia. It is important to remember that ataxia caused by disease of the cerebellar hemispheres will be ipsilateral to the dysfunctional hemisphere. The findings of appendicular ataxia are hypotonia, decomposition of movement, dysmetria, and difficulty with rapid alternating movements. We use the term dysdiadokinesis for this problem with rapid alternating movements. The following test of the neurological examination can be divided according to which system of the cerebellum is being examined. Vestibulocerebellum and spinocerebellum, or looking at midline ataxias, we use the test of station, walking, and tandem gait. For examining the cerebrocerebellum, or appendicular ataxias, the tests we use are rapid alternating movements, finger to nose, heel to shin, rebound and check reflex, and listening to speech. Traps. Although incoordination is primarily a symptom of cerebellar disease, it can also be seen from other causes such as a sensory dysfunction, which is a loss of large myelinated sensory axons serving proprioception. This causes a sensory ataxia. The key distinguishing feature for this type of problem is a positive Romberg, and a loss of position sense on the sensory examination. B, vestibular dysfunction. The key distinguishing feature for vestibular dysfunction is vertigo. C, cortical spinal tract disease. Cortical spinal tract disease can cause incoordination of the distal extremities. The key distinguishing feature here is upper motor neuron signs. Pearls. Appendicular ataxia is maximum at the greatest extent and endpoint of the motor act. So make sure you have the patient get to the full extent of the motor act when testing for ataxia. Remember that the Romberg test is a test for position sense and not of cerebellar function.